The Wuhan virus may have damaged your lungs forever. Let me just repeat that. The Wuhan virus could have damaged your lungs forever. India's Vellore-based Christian Medical College carried out a study. What did it find? That COVID-19 impacts the lungs of Indians more as compared to Europeans or Chinese. And why is that, you ask? Was the virus racist? Of course not. So what explains the findings of the study? Let's just dig deeper. Now, by now, we all know that COVID-19 hit our lungs the hardest. Patients had dry cough, difficulty breathing. In severe cases, COVID-19 resulted in pneumonia, bronchitis, even acute respiratory failure. Pneumonia is when your lungs are inflamed, they are filled with fluid, and this makes it difficult for the person to breathe. Bronchitis is when your airways become narrow because of too much mucus, your chest is congested, and as a result, you start coughing. Acute respiratory distress syndrome, or ARDS, can be fatal. This is when pneumonia progresses, shortness of breath sets in, and the lungs fail. The person is put on life support. Many don't survive ARDS. Now, we have seen or heard of COVID-19 patients battling these stages of lung infection. Many died battling the severe infection. What about those who survived? What happened to their lungs? And the lungs of those who did not have severe COVID-19 or did not have to be hospitalized? There is evidence to believe that COVID-19 left some of our lungs severely damaged. When researchers studied CT scans of patients in China, they found fibrotic abnormalities in the lungs, meaning the lung tissues were showing signs of abnormalities. And when that happens, often the amount of oxygen entering our blood from the lungs gets impacted. And in this case, fibrotic abnormalities were setting in as early as 3 weeks following the onset of symptoms. This was irrespective of whether the patient had mild, moderate, or severe COVID-19. Scary, isn't it? Another study published in the European Respiratory Journal found that patients had abnormal lung function even 2 weeks after being discharged from the hospital, meaning COVID-19 continued to affect them. Now, what kind of abnormalities are we really talking about here? Reduced diffusion capacity, small airways obstruction. Now, here's what the study conducted in India is saying. For Indians, the lung situation was worse than the Chinese or Europeans. Again, why? Now, one of the theories is more Indians had comorbidities or other underlying diseases, the likes of diabetes or hypertension. And here's another hard fact. For most of us who are breathing the polluted air in Delhi or Mumbai, our lungs are not exactly in their greatest shape anyway. But to point the finger at the exact cause of this disproportionate impact, we will need to read out some lines from the study. I'm quoting here. The difference in the impact of COVID-19 on different racial and ethnic groups is well described. Black, Hispanic, and AIAN people had experienced higher rates of COVID-19 infection and death compared to white people. It appears that our cohort of Indian subjects had more comorbidities and had more impairment of lung function than the European and Chinese patients. In addition, studies have shown that disparities in social determinants of health played a significant role in increased COVID-19 mortality, thus highlighting the social needs of low-income, low-education populations which impact equity in health outcomes, quote unquote. Now, what does this mean for those of you watching the show from India? It basically means that if you have been infected with COVID-19, then chances are the virus left you with lung damage. Could be lasting, could be temporary, could be minor, could also be major. Either way, the virus from China did damage your lung functioning in one way or the other. This India-based study observed 207 people. All of them were infected in the first wave of the Wuhan virus pandemic. They were told to take medical tests 2 months after recovery and rest. And what did the medical tests find? In 44% of the cases, the lungs' ability to transfer oxygen to the bloodstream was affected. 35% of the patients had restrictive lung defect. What does that mean? You see, when you breathe in, when you inhale, your lungs inflate, and when you breathe out, they deflate. But here, these people's lungs could not inflate freely. And mind you, this was 2 months after they had recovered from COVID-19, 2 months. On paper, they were supposed to be free of the disease, they were supposed to be healthy, but their lungs were secretly struggling. Their bodies were still struggling to breathe. Well, that's the Chinese virus for you. Technically, the pandemic is over, but chances are you and I are still secretly suffering. Look at what else the study found. 8.3% of the group had what's called obstructive lung defect. What's that? An obstructive lung defect interferes with the inflow and outflow of air to and from your lungs. And you know what's scarier? This study only took into account those who were infected during the first wave. We all know Delta was much, much stronger and deadlier. Imagine how that may have affected our lungs. And what does this tell you? The pandemic may be over on paper, but there is an epidemic of post-COVID complications. But who is paying attention to this health crisis? How many people are talking about how destructive long COVID is? How will you know if your lungs have been hit as well? Only your doctor can tell you that. But people battling long COVID often display brain fog, which means they have difficulty thinking, comprehending, concentrating. Your exercise capacity also is affected. In fact, the US Centers for Disease Control and Prevention also lists sleep problems, headache, pins and needles feelings, anxiety, and change in smell or taste as symptoms of long COVID. There is also tiredness, fatigue, fever, cough, difficulty breathing, chest pain, joint pain, changes in menstrual cycle. Again, something most women are not briefed about. You see, long COVID is not, and I repeat, is not limited to abnormalities in the lungs. There are different types of post-COVID complications out there. COVID-19 was a new virus. When this virus started spreading around the world, when it actually started jumping borders, when people started falling sick, no one really had any idea how to treat the people, how to cure patients from this virus. So the doctors started targeting symptoms. Patients were put on high-dose steroids. Who knows for sure how the patient's bodies actually reacted to the combination of a deadly novel virus and ultra-strong drugs. And believe me, even now, it may be too early to tell. COVID-19 was only detected in China in 2019, you see. At least that is what China tells us. And if we take that at face value, then this virus is just 5 years old. And to understand how viruses actually leave residual effects, we must look at another virus, another coronavirus that's been around for a while now. I'm talking about SARS-CoV-1. It was first reported in the year 2003 in Asia. The virus spread globally. One study of 71 healthcare workers affected by severe SARS found that even 15 years post-recovery, 36% of the patients had lung dysfunction. 15 years. And what are the different ways in which COVID-19 is likely to have affected us? There are cardiovascular issues. We've seen a spike of youngsters dying of heart attack in the last few years, in fact. Does that have anything to do with COVID-19? Doctors believe so. The Wuhan virus has also, in fact, left us with neurological changes, even gastrointestinal issues. These are things we will never know unless we actually start talking about them. And it is time to start addressing the destructive long COVID. And from Ukraine, let's now shift our focus to Pakistan, where greed, malevolence, ego, and a stolen election make us question, has Pakistan become ungovernable? You see, a week after the poll results showed a split verdict by the people, talks between two major parties in Pakistan to form a coalition government remain inconclusive. I'm talking about the Pakistan Muslim League Nawaz, PMLN, and the Pakistan People's Party, PPP. Now, one would think that elections would have put the country on the road to stability, but in the case of Pakistan, you see, the opposite is happening. First, the election produced a fractured mandate that triggered one controversy after another, and then amid widespread protests over poll irregularities, a senior official in Pakistan has admitted to election rigging. He says that the general election results were unfair.
I failed to conduct the elections fairly. I'm resigning from my post. I've committed a big mistake. We managed to declare 13 loser candidates as winner.
रावलपिंडी के 13 एमएलए की सीटें जो हारी हुई लोगों को हमने जितवाया है.
That was the Rawalpindi Commissioner Liaquat Ali Chatta. In a bombshell presser, Chatta told reporters that authorities in Rawalpindi changed the results of independent candidates. Now, to be clear, he is referring to candidates backed by the former Prime Minister Imran Khan's party. The independents led the poll results with a margin of over 70,000 votes. Chatta says there was so much pressure on him that he contemplated suicide. You heard that right. He said despite the pressure on him, he decided to make a public confession. He says he takes responsibility for the wrongdoing in Rawalpindi. He also accused the Chief Election Commissioner and the Chief Justice of Pakistan for their role in the rigging, allegedly. He was arrested by the police after the statement. Meanwhile, the Chief Justice of the Supreme Court of Pakistan has vehemently denied the allegations. Now, this changes everything. It throws further question marks over the legitimacy of the elections itself. They were held on the 8th of February, and Chatta's claims put the spotlight on Pakistan's Election Commission and the powerful military, which has been accused by many political parties of rigging the election. And why is that? So they can change the outcome to favor former Prime Minister Nawaz Sharif's party, the PMLN, and Bilawal Bhutto Zardari's party, the PPP. The hung parliament had sent these two major parties scurrying to cobble up a majority. As I mentioned, Imran Khan's PTI won the biggest share of seats, the independents backed by the PTI, but it wasn't accepted as the winner by these two political parties. Instead, they have joined hands to run the government. It will be headed by former Prime Minister Shehbaz Sharif. It comprises a group of 6 political parties, but talks to bridge the differences still remain inconclusive. And this only adds to the current political and economic instability in the country. It's a hard road ahead for Pakistan, to say the least. The PMLN-led coalition is already unstable, and I say that because even though the other big party, the PPP, has decided to back the coalition, it wants to keep a distance. The PPP does not want to join the cabinet. And why is that, you may ask? Well, it's because no one would like to be a part of a weak coalition government. The economy is ailing, like we've been telling you. Whoever forms the government will have to make tough decisions, and the PPP knows that. And this is why they want to stay away. Conversely, the PPP could decide to back out and pull the rug from under the coalition government's feet. The PMLN would be shattered. What future does this post-poll alliance really have then? The process of government formation is yet to begin. The assembly needs to convene. Reserved seats must be distributed based on the party seat proportions. And then the election of a speaker is expected to take place. The process is sure to be long and arduous. Meanwhile, Imran Khan's PTI is reportedly contemplating telling its candidates to align with a religious party, Majlis-e Wahdatul Muslimin. This is so that they can claim reserved seats for women and minorities, which the PTI would otherwise be ineligible for, following the poll panel's decision to revoke the PTI's political party status. But the biggest political test in Pakistan would be the country's economic management. The next government's immediate agenda includes negotiating a new, more extensive program with the International Monetary Fund. It is because of Pakistan's looming heavy debt obligations and the expiry of the standby arrangement in April. The next government will be compelled to commit to taking strict steps. The question is, will the next Prime Minister be able to fix Pakistan's problems? The UK has a new favorite dog. That's right, it's called the Golden Doodle. And it is as adorable as it sounds. This is what they look like. It's a cross between a golden retriever and a poodle. As you can see, it has the color of a golden retriever and the fur of a poodle. So the owners basically get the best of both worlds. Golden Doodles have hyperallergenic coats, and this makes the dogs very easy to care for. Their calm temperament appeals to most British families. These dogs are naturally curious and playful, and they need 1 to 2 hours of exercise a day. They are also very friendly with children and other dogs and pets. Their high intelligence makes them easy to train, and all of these qualities have made Golden Doodles the most sought-after pets in the UK. The Pets for Homes website, which rehomes pets, analysed last year's data, and it found that every advertised Golden Doodle had close to 1,000 potential buyers on an average. Each of these dogs now sells for over $2,000, but during the pandemic, they were worth over $4,000. The crossbreed dogs have been winning hearts. This includes celebrities as well. Singer Adele has 2 of them named Bob and Freddie. And those with Golden Doodles include Jennifer Aniston, John Travolta, Usher, Chris Hemsworth, as per various reports. In fact, many Golden Doodles are celebrities themselves. I'm not kidding. Have a look at this one. Its name is Brody. It has some 13 million followers on TikTok, Instagram and YouTube combined. Last year, in fact, the dog earned his owner, Cliff Brush, nearly $1 million, all through viral videos and brand deals. And it's not just Golden Doodles, by the way. Poodle crossbreeds in general are very famous in the UK and elsewhere. They often have the appearance of teddy bears, while Golden Doodles attracted the highest number of buyers. Maltipoo came in 3rd, Labradoodles were at the 6th place, and Cavapoos at the 7th spot. The Poodle crossbreeds also backed the top 4 places on the list of most searched for dogs. This was again according to a Pets for Homes industry report. And the website also reported a sharp decline in the sales of toy dogs. This includes Chihuahuas and common flat-faced puppies like the French Bulldog, Pugs, Cavalier, King Charles Spaniel, Boxers. This is not necessarily because of how they look, but because of their health and maintenance requirements. You see, all these breeds run a higher risk of having health issues as compared to other dogs. There was a time when stars like Reese Witherspoon would be seen sauntering down the red carpet with a cute puppy in tow. It was called the era of the celebrity handbag dogs. What about India? Which is India's favorite dog? It's again a crossbreed, but not a poodle. Indians have a soft spot for the Labrador retrievers. And as the name suggests, it's a cross between a Labrador and a Golden Retriever. They are friendly, medium to large working dogs known for their exceptional intelligence and gentle nature. And apart from that, German Shepherds, Golden Retrievers, Beagles, Pugs, and Indian Mastiffs are other breeds that are quite popular among Indians. Labrador Retrievers are also a favorite for Americans, in fact. So are Australian Shepherds. which are also famous in Germany. And for the Chinese, it's pugs and huskies. For the Japanese, it's Shiba Inu. For Russians, it's Doberman. And as it turns out, Rottweilers are the most famous dogs in the world, as they are the #1 dog breed in 34 countries. What about you, though? Which one do you have at your home, or which one is your favorite if you ever decide to have one as a pet?